Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about updated mechanics to submit a ClearCorrect clear aligner case for submission, how to get a really good quote-unquote Clin Check. Clin Check is a branded term used by Invisalign or Align Technology, how to get a good aligner setup, or they call them clear pilot setups with ClearCorrect. Now, if you are a fan of my YouTube site, which is an orthodontic site to help general and pediatric dentists, and for the most part, it's geared towards doctors, but patients listen to it too to understand concepts more. But you'll see that I have a lot of content about ClearCorrect going back 6 years, but it changes over time. They have really improved. And I've always been a big fan. I mean, I was really close to their team way back when, back in 2014, 2015. I knew them really well. They got bought out by Straumann. It got a little funky for a while. It's getting better. The culture still isn't what it used to be, in my opinion. A lot of really good people were fired and left, really talented people. But in any case, you know, I've been observing, and I have a lot of doctors who are diehard ClearCorrect fans, and I've been realizing that you can really optimize. They give you the tools to optimize and get a really good setup and get a really good outcome. It can do almost everything that Invisalign can do. I say almost everything. There's a few things that aren't quite as good, but for the most part, if you know how to drive the boat, you can get a good outcome with ClearCorrect. And it definitely has some benefits, depending on how you want to look at it. So you can watch all my other videos on ClearCorrect versus Invisalign to learn all that. Today, we're going to specifically go over how to submit a case. Now, I did take these snips directly from their portal. So as always, Straumann ClearCorrect, if I put up any of your IP and you don't like it, you can always ask me to take it down. You don't have to send me ClearCorrect has never sent me a cease and desist or a nasty letter. I'll let you guys know. Almost every other clear aligner company has. That's out there. Something from their legal team telling me to take something down, do something. ClearCorrect has not. So I consider them a friend if they don't harass me. So in any case, yes, those are their snips, but it's good stuff. I'm not going to say anything bad. If anything, it's just going to help their doctors get better outcomes. And anytime I make a favorable video, you guys are smart enough to let me lead it up, because it's going to help a lot of people. And this is what people are asking for, because they find your website a little clunky to submit a case. So I just walked a doctor through submitting a case yesterday. It had been a little while, and I was like, oh, it's changed. It's actually pretty cool. So let's go over this. All right. So a couple points I want to go over. For the most part, if you've done Invisalign, submitting a ClearCorrect case should be should be a breeze. And for those of you who are starting out as ClearCorrect doctors, not wanting to do Invisalign because you don't have the iTero, or you have issues with the way Align Technology runs their whole scanner policy, and that's why a lot of you guys don't want to do it. You're just upset at Align Technology, and I get that. I think what they're doing is so stupid, and I've even told Joe Hogan that to his face. But anyways, I said, you know what, I realize you're also in the scanning business, but I know in other countries these scanners work, because you guys take them in other countries, and I know there's a lawsuit in the US, but this is BS. You're hurting doctors. And what Align Technology did 4 or 5 years ago, when they just slammed it down and stopped accepting other scans, was really a boost to ClearCorrect. I was like, oh, you guys should take this and run with this. And they have, so good for them. Okay, so, and anyways, like I was gonna say, the best way for you to learn how to do good ClearCorrect is to watch all my Invisalign videos, because a lot of the concepts are exactly the same. The colors, the branding might be different, but the concepts are the same. Now, of course, Invisalign is a slightly different material. It has a slightly different trim line, so I do things slightly differently. But for the most part, if you understand the concepts that are in the Invisalign channel, which right now is totally free. I do not have a paid course for Invisalign. So you can go into my YouTube channel, scroll down to the Invisalign playlist, and just watch it all. I've tried to sort certain concepts and put them in ClearCorrect in its own off-label channel, but I'm still building that. Okay, so point one, this is something different that they don't have with Invisalign. They don't have a recommend versus limit. Well, I guess they do, because when you submit for Invisalign, they ask you to choose what package you want. There is no recommend. So they say, do you want an express? Do you want a light? Do you want a go? Do you want an assist? Do you want a moderate? Do you want a phase 1, Invisalign first? Do you want Invisalign second? And it's confusing, right? Well, not for me, but for you guys. So here, there's only 2 options. It's recommend or limit. Never pick limit, okay? No, don't pick that. Click recommend, and then when it comes back, you're actually going to double the align. Actually, ClearCorrect is 2.5 times the aligners. Their movements are very aggressive. 2.5. So if they recommend 10 aligners and you like the setup the way it moves, you agree with how it moves, then you just made that 25 aligners, okay? That is what makes ClearCorrect predictable. This never works out. Limit never works out. And never take the number that they recommend. You always multiply it by 2.5, okay? Also, the other thing you want to toggle, their default wear schedule is going to be 2 weeks. That's dumb. They're going to make your movements way more aggressive and way less predictable. Always click 1 week. They have, I think, a 1 week, 10 days, 2 weeks. 3 weeks is insane. I mean, it's like direct-to-consumer stuff. The bigger the movements, the bigger the steps in between aligners, the more likely it's going to go off track. The higher the forces, the worse it is for the teeth. The more pain the patient has, the more likely it's going to unseat and untrack, okay? Always 1 week. Now, I'm not sure if you click 1 week, you might not have to multiply it by 2.5. All my doctors always just take the default, which is 2 weeks, which is why I multiply by 2.5. So I'd have to see what some setups look like with the 1 week to see if it really makes a difference. I might only multiply by 2. That's what I do with Invisalign, which is a 1 week. So I just thought I'd give that disclaimer. Ooh, this is pretty small. Okay, so these are things that you need to toggle, okay? So I don't know if the default is leave or improve, but there's a maintain or improve. I usually have everything as improve unless I know I don't want to do something, okay? So this is midline, overjet, overbite, arch form, canine relationship, molar relationship, posterior crossbite. I usually keep maintain on posterior crossbite because you really shouldn't be messing with posterior crossbites in adults. And in kids, if you have a posterior crossbite, you should have done an expander. So that should always be maintained. There's a few exceptions, like a single tooth posterior crossbite, like on number 5 or something. Okay. Yeah, I'm gonna fix that. But see a lot of my videos on fixing posterior crossbites and aligners, and it probably will say Invisalign, and you'll learn more about that. Okay, now this is how do you want to do it? And if you watch my video on what are the 5 different ways we can get space in crowded teeth with aligners, let's quickly go over what the 5 different ways are, right? You guys usually can spout off 2 or 3. You don't always know all 5. First one is expand, right? Expand arches. Watch my videos on arch expansion. Can and should you expand arches in adults? Well, depends. You got to look at the bone. You got to look at the angulation of the teeth. You got to look at the perio. You got to look at the age of the patient. Are there signs that we're pushing it to the limits? Is there recession? So in terms of expansion, don't know. And you know what? You certainly don't let the aligner company decide if you can expand. Their default on every single patient that has crowding is going to be expand arches. So you need to put your doctor hat on. And if you don't know, this is where you need to consult with an orthodontist and or a periodontist. And that's where I like to, for expand and procline, y'all don't know what you're doing. You go to your little friendly periodontist and say, can I expand? Can I procline? Because most often they will say, if they think there's a thin biotype or something like that or a risk, they'll say, no, do not expand, do not procline. That just took the risk and responsibility off of you, put it on the periodontist. So now there's no liability if something happens. Of course, you have to do what they say and build that into the treatment plan. Remember, every single crowding treatment plan from ClearCorrect will come back with tons of expansion and tons of proclination. They just blow it out and blow it forward. Why? Because that's their default mechanics. They are not orthodontists. They are not general dentists. They are not the treatment planners. They just do what you say. If you say recommend, they go with their default plan, which is expand and procline, which in most adults, unless you are like 20, it's probably not a great idea. So you have to decide if it's a good idea. Okay, so that's expand and procline. You got to say no or yes or if needed, okay? So on a lot of adults, I'm going to say no. And in terms of the procline, again, if you don't have a Ceph or a CBCT slice, I don't know without this. If you work with me, a lot of times I'm going to say, well, where's my Ceph? You know, like I don't know. This is a major crowding case, you know. I can kind of look at the E-line. I can kind of look at the angulation of the teeth, but that is subjective, not objective, and I don't know the answer to that. So without that sagittal slice x-ray of a CBCT, so I can see the angulations, without that lateral cephalometric x-ray where I can run numbers on it, and you guys, I have an entire playlist on it, it's not that hard. I'm glad to help you out with it. I don't know. So that covers expand and procline, which is going to be their default. Their other 3 different movements are not going to happen unless you ask for them. Now, anytime I take a case that's ortho, in my mind, I already know how I'm going to move teeth. And if I'm not sure, I'm going to get that Ceph. I'm going to get that lateral CBCT slice, and that way I know. I'm going to get that pano. Don't be operating with just bite wings or an FMX. You don't know if there's good ridges so you can distalize. How can you do ortho blindly? This is where it's going to bite you guys in the butt, because if there's a complication, if there's a problem, if that patient complains to the dental board, if that patient complains to the insurance company, and trust me, it happens even with orthodontists quite frequently. Everyone's out there to get a quick buck if they can. And there's a lot of dirty lawyers out there and a lot of dirty dentists out there that will throw other dentists under the bus. If you didn't literally make this plan in your brain, you hear how I'm going through this narrative. I'm going through each of these check boxes and I'm telling you the way I'm thinking for every single case is going to be different. And there's things you have to look at. You have no business doing clear aligners because you're going to get bitten in the butt one of these days. And you know what? You're going to be coming to me and saying, what should I have done? And, well, you did everything wrong. And you know what? ClearCorrect not going to tell you any of this. Invisalign's not going to tell you any of this. That's why us orthodontists are sitting here laughing at what you guys are doing, because you're like, you guys are doing it wrong. And the way that they teach you is so wrong, which is part of the reason why I make these videos, because, hey, I have a general dentist husband who does ortho, and I was just disgusted and horrified at the stuff he learns in the lectures that are targeted towards GPs, the stuff he learns in the CE classes that are targeted towards GPs. Not only is it wrong, it's sloppy, and it's bad orthodontics. Yeah, you guys and us orthodontists sit there and laugh because we go, hey, they're just going to jack it up and the patients are going to come back to us and it saves the profession. We don't care. But I do care, okay, because I care about these patients. All right, so we talked about expand, we talked about procline. What are the other ways? You've got IPR. Sure, I like IPR, nothing wrong with that, but I also hate IPR because IPR takes me a long time. IPR takes a lot of chair time. Patients hate IPR, okay? They think they like the idea of it, but then they hate it when they actually have to do a lot of it. And 45 minutes to an hour of my chair time is a complete waste of money. I'm wasting money on this case, right? If a patient is demanding a ton of IPR, I'm probably not going to take that case. It is not worth my time, especially if it's an insurance case. And anyways, anytime you have that much IPR in a case, it is never, ever, ever accurate. Until there's like a laser system that precisely does micro amounts of IPR, that's a game changer. Someone can invent that. Until that happens, I hate IPR and I actually don't want it. And I'll leave it on only if needed. Sometimes you do need it, and if you're not sure why, like there's a Bolton discrepancy, you need to go to all my Bolton videos or IPR videos. All right, the last one that you guys probably don't know about is distalize. That's my favorite way to make space, and I think I have yes marked here, because of course you can't have impacted teeth, and you can't have erupted third molars. If you want to distalize third molars, need to be gone. But in a lot of cases with crowning, it's a fantastic and very accurate way to make space without damaging teeth. Very, very easy, but it's time consuming, which is why, of course, you need to not only be doing 1 week, but you need to be doing recommend. And these cases are going to go 60 to 80 aligners. That's a year and a half. Nothing wrong with that. That's normal for braces. Cases take a year and a half. So those of you who are trying to speed things up and do anterior only treatment, you're doing weird things with your cases, okay? So, and getting to that treatment approach for full correction versus aesthetic. You don't pick this. No. They say they suggest it for class 2 cases. That's insane. You guys are nuts. It just means a ton of IPR. Not only is it going to look weird, but if we're all doing aesthetic or social 6 and we're not moving back teeth at all, still all weird things will happen. The arch bone is strange. Things aren't interdigitated right. It never turns out well. And again, you can't be billing D8080, D8090. You got to bill limited if you do that, okay? Which changes your reimbursement. And if you bill the wrong thing and you marked this, it's going to come back to bite you in the butt later. Guaranteed it will, okay? So be really careful. Always full arch correction, okay? Unless the patient has, there's a few one-offs where I'll do a social 6. Patient class 1, maybe has a tiny gap and there's clearance for me to close the space. I can close the space on the top only with the front teeth only without having to move the bottom teeth, and I won't have any interferences. Great, yes, I will do aesthetic. Or on a case maybe that has a little lower crowding, but we have overjet so I can straighten it without having to do too much movement or expansion or anything like that. Great, I'll do aesthetic, but that's a one-off. It's maybe like 1 or 2% of the cases I've done. All right, lastly, you've got these things down here. This is gonna tell you exactly how you want to do it, right? And the nice thing about ClearCorrect is you can mark, you want universal, you want Palmer, blah, blah, so it's nice. Obviously you wanna mark the teeth you don't wanna move, like baby teeth, implants, and bridges. Make sure you mark that off. You don't mark that off, they're gonna move them and you're gonna have trouble, okay? It's your job to mark them, it's not their job to look at your x-ray. Avoid engagers. Only time I mark that is when I've got a veneer, a gold crown, or a really nice porcelain crown that I don't want to damage. I'm going to go ahead and mark that, okay? Or some tooth that's like traumatized or damaged that I just got to block the movement, or a baby tooth. So then you want to avoid the engagers. Keep in mind, if you avoid engagers, you're probably not going to get movement on that tooth. So you can't say, I don't want engagers on the front teeth and expect them to move, because they're not going to move. So don't be doing it for cosmetic reasons. If a patient is that picky that they don't want engagers for or attachments for aesthetic reasons, punt them to someone down the street, because I'm not going to take them, because I can't promise you that we won't need them, nor am I even going to do a case where you don't want them, because it's just going to be unpredictable, and you're going to get frustrated, I'm going to get frustrated, and no one's going to be happy. So bye-bye. Go to someone else, go to SmileDirectClub. You can deal with them. All right, teeth to be extracted. I have seen, of course, lower incisor extractions, no problem. You can also mark if you're having wisdom teeth taken out, mark that, yeah? So they don't include them in the plan, they know that they're out. Have I done or seen a 4x extraction case in ClearCorrect? I think there's a few that I know that are going on. I haven't personally done any because I've always used Invisalign, those work out great. But you can definitely mark the ones that need to go. But I mean, they say that you can do 4x extraction, but not sure yet, okay? And this is leave these spaces open. If you have an implant, or if you're leaving spaces for veneers, you want 1/3 mesial, 2/3 distal, blah, blah, blah. You can go ahead and leave the spaces open. And they usually have a space where you can type things into. So I always recommend being as clear as what you want and how you want it. Yeah, they have a comment section. So that's where I'm going to say, I want this to be 50 to 70 aligners. I want to use up to 2 millimeters of sequential distalization per quadrant on the lower, and up to 4 millimeters of sequential distalization per quadrant on the top. Do not expand arches. Do not procline arches. Do not round trip. Make space first and then align the teeth. Make sure you have full size attachments on teeth 7 and 10. This is like a typical treatment plan for me that has crowning, okay? So I tell them exactly what I want and how I want it. And now they also have bite ramps, which is great. There's a place where you can mark if you want them. And make sure you ask for them. I put them on almost every case. ClearCorrect is notorious because of the thickness of their plastic for having posterior open bites. If you don't put bite turbos on it, you're probably going to get a posterior open bite. It's default on almost every case for me, with a few exceptions. If you're not sure why, you should watch my videos on anterior bite turbos with Invisalign and then extrapolate it into ClearCorrect, because now they have it, which is a game changer for their aligner company. So again, Strawman, if you're listening to this was a completely bullish post about using ClearCorrect, how to submit cases. I'm using it more and more. Only thing I wish it would do is I wish it would save your damn password. That drives me nuts. At least Invisalign has an option to Google save the password, so it saves it and so you can get in. It's a big pain in the butt to have to type passwords. I hate passwords. So I think that would be really cool if they had that. If they had a little more flexibility. I think they're starting to have some more staff functionality and notification alerts, but still pretty clunky. You know, it's definitely not streamlined Invisalign. Of course, I would love it if they had an option of like ClearCorrect Virtual. I know that they partner with DM, because DM is partly funded by, dental monitoring is partly funded by Strawman. I think they invested in it, but it just doesn't connect. It doesn't sync. So there's no way to be doing virtual check-ins and having that data coming right into your dashboard, as far as I know. Again, anyone from Strawman or ClearCorrect, if I'm saying anything wrong, or if you want me to retape this, educate me, spend some time teaching me. It's been a while since I've talked to your team. Happy to update this video. All right, this is pretty much it. So check out ClearCorrect. It's definitely a much better product than it used to be.